Trinity Colegrove, who's in Cal Poly Humboldt, rising senior in the UW Grid Lab, EEG lab. Okay, ready?
Hello, I'm Trinity Colegrove. I'm a proud member of the Hoopa Valley tribe, and I had the most amazing opportunity to work in the grid lab for the last 8 weeks. Um, and I am presenting on understanding approach avoidance behavior in the brain. So to start us off, what is approach avoidance? Approach avoidance in psychology refers to a type of conflict a person experiences when faced with a decision or situation that has both positive and negative aspects. This can create ambivalence or mixed feelings because a person wants to move both towards and away from the same decision or goal. You can think of this, an example of this is if you were to walk in the forest and you come across a tunnel. Do you A, take the risk and go through the tunnel, or B, play it safe and avoid the tunnel altogether? Generally, people are more inclined towards positive outcomes and avoid potentially harmful or negative ones. And these decisions are not just psychological, but they're biological too in the wiring of our brains. And so approach avoidance isn't just about decision making, but it's also central to mental health. And in neuropsychiatric disorders like obsessive compulsive disorder, depression, and bipolar depression, these behaviors tend to be more on the avoidance side. And so behaviors such as fear of going outside, avoiding touching objects, and making daily decisions can be life limiting and disturb the wellness and decrease the quality of life in these individuals. And so the figure on the top right I have here is the deep brain stimulation of the ventral capsule, ventral striatum, um, as a treatment option for obsessive compulsive disorder patients, which has a response rate of 66%. And on the bottom here, I have the approach avoidance axis. And then the purple demonstrates this shift of behavior from a more avoidant state to more approaching. And so approach avoidance is a really key behavior in these neuropsychiatric disorders, and it's something that we need to know more of. And in order to do that, I have been working and running this probabilistic approach avoidance task. For this task, the patient is shown first a cue screen of two options of paired risk and reward. The red circles represents the probability of risk, and the blue circles represent the probability of reward. And so they'll choose the left or right option. In this case, they chose the right option, which is less risky and less rewarding. After this, the patient has a 50-50 chance of receiving the reward wheel or the aversive wheel. If they get the reward wheel and it spins and lands on black, they get a neutral outcome. And if it lands on blue, they get a rewarding outcome. However, if they get the aversive wheel and it spins and lands on black, they get a neutral image. And if it lands on red, they get an aversive provoking image. And these images are a type of stimuli used in clinical studies to evoke a negative physiological response. In the context of our research, we're using them to trigger avoidance tendencies. And so in order to get a better understanding of what this behavior looks like in a healthy brain, we have been working with the epilepsy patients in the EMU who have a broad range of coverage of electrodes implanted intracranially. And we are able to characterize this neurophysiological response through the situation where the patient receives clinical care and monitoring neural activity for epilepsy. The figure on the right is a visualization of epoch neural data waiting for further analysis. This process involves segmenting the data by trial and aligning it in time based on the behavioral event during the task. For the task, the trial is aligned with the time when the display choice screen is first shown to the patient. This alignment enables analysis of trial average neural responses, enhancing our understanding of how the brain responds to different behavioral states elicited during the task. As for our results, what I have here is a plot. As you can see, there are two different lines. One is the approach trials highlighted in orange, and the other is the avoidant trials highlighted in blue. And this is in the left amygdala, which is involved in emotional processing, like fear, anxiety, anger, aggression, things like that. At time 0, we have the display choice screen shown to the patients. And as you can see, there's high activity for avoidant trials during viewing decisions. And again, approach trial is high risk, high reward, and avoidant is low risk, low reward decisions. As for the future implications, understanding approach avoidance in healthy brains gives us a better understanding of neuropsychiatric disorders through this neural activity observation during the probabilistic approach avoidance task. Additionally, probabilistic approach avoidance tasks can be used in future studies and research and clinical practice as both a baseline and a post-treatment assessment. Also, using neuromodulation, again, to shift these patients across the approach avoidance axis so that they become more approaching and less fearful. And lastly, if we can identify neural biomarkers, so identifying a signal that we can measure and then use an indicator in psych deep brain stimulation patients to see if we're targeting the correct regions and influencing this behavior. And then I just wanted to say thank you to Dr. Ellenbogen and Sandra and my mom for coming and all my family on Zoom. And yeah, I'm just very grateful to be here and get to experience this. And yeah, so